Hi, my name's Rachel and I'm a student nurse. Osteoarthritis can have a big impact on your life, but there are things that you can do to take control of it. In this video, I'm going to help you to learn more about the condition, as well as showing you how to start off becoming more active. Completing this video every few days will help you to become fitter, stronger, more confident and more knowledgeable about your condition, as well as helping you to continue doing the things that you love or starting new activities you enjoy. Before you start, it's important to ask yourself if you feel well enough to exercise today. Don't exercise if you have chest pain or tightness, dizziness, nausea, if you feel clammy or cold, if your joints or muscles hurt more than is normal for you, or if you feel really unusually tired. If you have any new problems, seek advice from a health professional before you start. In this video, you'll complete a warm-up, day-to-day movements, a strengthening movement and a cool-down. Take rest when you need to and only do what you can manage and what you feel comfortable doing. You'll need a dining room chair, some water and make sure you're wearing comfortable clothing. Most importantly, try to wear fitted, supportive shoes which have a cushioned sole. Feel free to pause the video to get these things together and then restart when you're ready to go. So, we're going to start with the warm-up. The warm-up prepares your body by loosening up the joints, warming up your muscles and gradually increasing your heart rate. A warm-up helps your body to cope with the activity ahead and can also reduce the chance of injury. Experiencing joint and muscle pain during this activity is likely, especially if it's your first time doing this. Activity is not damaging to your joints and we'll discuss this more later on. I'll be demonstrating a standing warm-up, whilst Martin will be demonstrating the seated version. Please join in with whichever you feel most comfortable doing. Throughout the video, try to maintain a good posture by keeping upright with your shoulders back and head up. If you're sitting, sit away from the backrest of the chair. Let's start with some backward shoulder rolls. Drop the arms by your side and roll the shoulders backwards. Try a big, exaggerated movement, making the circles as big as you can. Change to a forward shoulder roll now. Next, we'll sweep the arms forward whilst dropping the head and then bring the arms back, lifting the head. This is a nice dynamic movement to stretch the upper back and the chest and shoulders. Now, place the hands on your shoulders and reach up with one arm, stretching up and to the side. Change and do the other arm. Keep the lean within what feels safe for you. Bring the arms across the chest now and we'll do some torso twists. In your own time, turn your upper body to look over your shoulder. Then turn back to the centre and turn to look over the other shoulder. The movement should be gentle and relaxed. Now, some moves that will start to increase the heart rate and breathing. Remember to keep that good posture. Let's start marching. To make it harder, start to move your arms. Now try lifting the knees higher. If you feel unsteady for any of the exercises in the video, either hold onto a chair or a stable surface, or try the seated version. Now, next, take your heel back towards your bottom. Again, use the chair for balance if you need to. You may not be able to take your heel back very far, but just do what you can. You should find with regular exercise, your knees become less stiff and painful and you can move them better. Finally, let's try some small knee bends. Stand with your feet hip distance apart. Imagine you're going to sit down by moving your bottom backwards and start to lower yourself. Make sure your knees don't travel too far forwards when they bend. Here's a side view. If this feels okay, you can start to go a bit lower, but remember this is the warm-up, so should feel light and easy. You may find initially this movement generates some pain in the knees. This pain does not mean that more damage is occurring in the joint. It's more of a protective mechanism of the body because the arthritic changes in the joint have made it more unstable. Right, well done, that's the end of the warm-up. Hopefully you feel a little warmer and more prepared to exercise. Pause the video if you need to have a small rest or have some water before we start the next section. We're now going to complete 2 5-minute blocks of movements similar to those which we do in everyday life. Throughout, I'll be giving you snippets of information from current research and guidelines about osteoarthritis and what you can do to help to manage it. We're going to start with a march on the spot. Stand or sit up tall with a good posture, shoulders back and head up. Throughout the video, find a speed that's comfortable for you. As you get fitter, you should try to increase the speed of your movement. Let's continue with this for 1 minute, and if you feel able, push the arms forward and back. So, what is osteoarthritis and how does it affect your joints? People used to refer to it as a wear and tear condition, but new research shows this isn't quite correct. As part of normal life, your joints are exposed to constant, low-level damage that happens over many years. In most cases, your body repairs the damage itself and you don't experience any symptoms. But in osteoarthritis, the repair process alters the structure of the joint, causing pain, stiffness, and problems in moving. Some people also have symptoms such as swelling, tenderness, or hear grating or crackling sounds when they move the joint. So, to summarise, the symptoms you experience don't come from the joint wearing down, but actually come from a faulty repair process. Well done with the marching. There's 10 seconds left before we change to a new exercise. Now, let's try a minute of high knee marching. Try and lift the knees nice and high whilst maintaining that good posture. Being able to lift the knees high is crucial for many daily tasks, for example stepping into a bath or lifting the leg high enough to step onto a curb or onto a bus. With osteoarthritis, almost any joint can be affected, but the condition most often causes problems for people in the knees, hips, and small joints of the hands. For some people, the symptoms can be mild and may come and go, but other people can experience more continuous and severe problems which make it difficult to carry out everyday activities. Also, it's so important to know that your osteoarthritis doesn't necessarily get worse with aging. How you manage it can have a big impact in preventing it getting worse. Good job with those high knees. There's just 5 seconds left. Now, let's try bend and taps. Keep your feet hip distance apart, bend down, straighten up, and tap the foot out to the side. Just try small knee bends to start with. Make sure the knees are bending in the direction your toes are pointing. If you don't want to do knee bends, you can just tap the foot out to the sides like this. And please go at a speed that's comfortable for you. Bending is a crucial movement and can become difficult if you have osteoarthritis. Trying to strengthen the muscles around the knees can help to improve this. I'd recommend trying to complete this video every other day and pace yourself the first few times. Then, as you get more used to it, you can try to work a bit harder until you feel you're getting slightly out of breath and a bit warmer. Working at this level of moderate intensity is where you'll see improvements in how well your joints, bones, heart, circulation and lungs work, which helps to manage and prevent many other health conditions. Great job! We're now changing to side steps. Face the chair if you need to hold on for balance for this one. A common misconception with osteoarthritis is that moving the joints causes pain, so exercise must make them worse. This isn't the case, and actually the opposite is true. From research, we know that regular exercise dampens the pain response and improves how well the joints work. The thinking behind this is that exercise helps to make your muscles stronger, which support the joint better, and the muscles absorb and soften impact, rather than the joint taking the brunt of this. Because of pain, you may have found you've avoided doing certain activities. If you avoid activities, then you can lose muscle strength, which means that more stress will be going through the joint, causing more pain and an increase in your symptoms. It can become a vicious cycle of avoiding activities, muscles weakening, and more pain. Starting to become more active is a way to combat this. Our next movement is a step forward and then back. This lunging forward movement is similar to what we do when hoovering or sweeping. Try to make sure the front knee bends in line with the toes. Keep up the good work, a rest is in sight. So let's summarise what we've learned about osteoarthritis so far. 1. The symptoms you experience don't come from the joint wearing down, but actually come from a faulty repair process. 2. Arthritis does not necessarily get worse with ageing. 3. Any joint can be affected, and it affects people in different ways. 4. Start off exercising gradually, then try to work at a moderate intensity. 5. Being physically active has many benefits and can help to reduce pain and improve how well your joints work. 6. Pain during exercise doesn't damage your joints. And 7. Becoming more active can help break the cycle of inactivity. Okay, well done. We're halfway through this section. Feel free to pause the video now if you need a short rest. Otherwise, let's continue for the next 5 minutes. Right, let's get back to marching, but this time pump the arms. Do this by keeping the elbow fixed and moving the arm from the shoulder joint. If you want to increase the intensity, try moving faster like this. Or, if you're finding it too hard, slow down. Do the legs only, or switch to the seated version. As well as becoming more active, there are other things you can do to help to manage your osteoarthritis. If you're carrying a few extra pounds, then losing weight can help reduce your symptoms. Carrying around excess weight puts extra strain on the joints, which can make your symptoms worse. If you can lose weight, this will take pressure off your joints and help them to become more mobile again. That being said, losing weight can be easier said than done, especially if you've not been able to be as active as you once were. Making changes to your diet can help, but you must be the one to decide what changes you're prepared to make. Small changes such as swapping certain foods with healthier ones, or reducing portion sizes can have a big impact. If you want more support, then take a look at the NHS Live Well website. Well done for the marching. We're now going to change to a high knee march, so start to lift the knees higher. If you feel comfortable and balanced to do so, try tapping the knees with the opposite hand. This creates an element of rotation which is commonly used when turning to reach for something or when looking over your shoulder. Other options to help manage your osteoarthritis pain can include applying heat or ice packs to the joint. Some people prefer heat, others prefer cold, so see what works best for you. Another recommended treatment of pain is the use of a TENS machine. These are small devices that involve the use of a mild electrical current and can be helpful in managing pain. You can buy these in pharmacies or online. Great work, keep going if you can. Now, let's challenge the coordination slightly and try a bend and reach. Bend, taking your arms down, then straighten, reach up and tap the foot out to the side. This movement is similar to when putting your shopping away from the floor into a cupboard. You can just do the bend and reach, or legs only if that suits you better. Medication is another way you can help to manage your osteoarthritis symptoms. First-line treatments include the use of paracetamol and an anti-inflammatory painkiller that's applied to the skin at the joint. These can be purchased over the counter from a pharmacy. If these don't help, there are many other pain relief options available to you, so it's important to go and discuss your preferences and concerns with your GP or practice nurse. Great job! There's just 5 seconds left before we change. Okay, into side steps now, and let's push our arms out to the sides as if we're opening the curtains or looking for something to wear in the wardrobe. Remember to go at a steady speed if this is your first time doing this video. To work at more of a moderate intensity, try increasing your speed. When out, wearing appropriate shoes with shock-absorbing soles is another way you can manage your osteoarthritis. Others find that wearing braces, joint supports, or insoles can help, and you can ask for an assessment for this from your GP. If your arthritis is interfering with daily tasks, there may be assistive devices that you can get to help. For example, electric tin openers, tap turners, walking sticks, or raised toilet seats. Your GP or practice nurse can refer you to an occupational therapist for help with this. Our last movement is stepping forward. As you step forward, push the arms forward and down, as if hoovering. So let's summarise the information we've gone over in this section in things you can do to try and manage your symptoms. 1. Becoming more active will help. 2. Losing weight if you're overweight. 3. Applying hot or cold packs to the joint. 4. Electrotherapy by using a TENS machine. 5. Pain relief medications. 6. Wearing shoes with shock-absorbing soles. And 7. Assistive devices can help with daily tasks. It's important to say there are alternative approaches which you may find helpful despite there being a lack of evidence supporting them. Things such as aromatherapy, acupuncture, copper bracelets, turmeric, and nutritional supplements are some examples of these. Right, 5, 4, 3, 2, 1, and stop there. Well done. You've completed this section. Take a short rest if you need one before we move on to a strengthening movement. In this section, you'll need a dining room chair, so have one ready. Now, we're going to complete a movement that will strengthen the muscles around your hips and knees. It's called a sit to stand. I'll demonstrate this first. Before you start, make sure your feet are hip distance apart and close to the back of the chair, and you're sat near the edge. Place your arms across your chest and stand up slowly over the count of 3, making sure your knees bend in the direction your toes are pointing. Lower yourself back down slowly with control over the count of 3, as if you're going to sit on eggshells and you don't want them to break. Watch out for the knees buckling in together like this. This is not what we want. If you find the seat feels too low, either find a higher chair or place some cushions on the seat. You can also use the armrests if the chair has these. If this is too hard still, then you can do small knee bends, which Martin will be demonstrating. Make sure your knees stay in line with the feet when they bend, and move your hips backwards rather than the knees moving forwards. We're going to perform 10 of these and then take a rest and repeat. So get ready and stand, 2, 3, down, 2, 3, up, 2, 3, and 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 down, 2, 3, that's halfway, up, 2, 3, and down, 2, 3, 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 last one, up, 2, 3, and down, 2, 3. Well done. We'll have a short rest for our muscles to recover before doing a final set. It is important to acknowledge that some movements may create pain, and as mentioned before, this is not causing damage to the joint. If you experience pain or discomfort when doing an activity, it should plateau and it shouldn't continue to significantly rise. It should be discomfort that you can cope with, and it should feel manageable, and the discomfort should gradually decrease after you finish the exercise. If your pain follows these 3 points, then it's safe and suitable to do the activity. If not, then go to your GP or practice nurse who can refer you to a physiotherapist to get individual advice around becoming more active. If you can understand your pain better, then you're less likely to have flare-ups of your symptoms. Right, let's try the last set of 10 sit-to stands. So, get ready and stand, 2, 3, and down, 2, 3. Up, 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 2, 3, and down, 2, 3. That's halfway. Up, 2, 3, down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Last one. Up, 2, 3, and down, 2, 3. Well done. Great job. To finish, we'll complete a short cool down. We're going to perform some stretches to help to lengthen the muscles and return your body back to how you felt before you started this video. The first stretch we're going to perform is a calf stretch. This muscle is located at the back of your lower leg. Place your hand on the chair and place one leg in front of the other. Bend the knee forward of the front leg and straighten the back leg. Make sure both of your feet are pointing forwards and the heel of the back foot is flat on the floor. Change legs over now, repeating this process. We're going to hold these stretches for approximately 15 seconds each. Good. The next stretch we're going to do is a seated hamstring stretch, and this stretches the muscles at the back of the thigh. Sit towards the edge of the chair so you can straighten the leg. Place your hands just above the bent knee. Sit up tall and then tip forwards until you feel a stretch at the back of the thigh on the straight leg. If you want to increase the intensity of this stretch, you can bring your toes towards you so they point up towards the ceiling. You'll feel this further down the leg. Change legs, swap the hands over, sit up tall and sit forwards. It's important on all of these stretches not to hold your breath. Try to maintain normal breathing whilst doing the stretches. Bring your toes towards you if you want to feel a deeper stretch, and remember to keep breathing. We're going to change to a side stretch now, so place one hand on the hip and the other hand reaches up and over the body so you can feel a stretch down the side. If you'd prefer, you can have both arms by the side. Either version is fine. Remember to keep breathing here. We're going to change sides now. So if your shoulder doesn't like being lifted above your head, keep both arms at your side. We're now going to change to a seated upper back stretch. Bring the arms in front, link the fingers together, push your shoulders forwards and drop the head down. You should feel a stretch in the upper back and the neck. Try to keep the arms up and keep breathing throughout. Good. Let's change to a chest stretch. So link the fingers together behind the back, pulling the shoulders back or having your hands facing down in the small of your back. Either is fine. The important thing is to pull the shoulders back, lift the lower rib cage up, taking the heart towards the sky. Keep breathing throughout this stretch. Great, on to the finishing move now. Breathing in through the nose, stretching up, and breathing out through the mouth. Breathing in through the nose, stretching up, and breathing out through the mouth. Breathing in through the nose, stretching up, bringing the hands down together, and give yourselves a clap. Well done. You've completed the exercises now. Well done on completing this video. I hope you found it useful and you feel more motivated to take control of your osteoarthritis.